to waste any more time, it gives me a lot of pleasure to introduce Fiona World. She's the CEO of Open Gate Institute, and she's going to do Sandtray Therapy, a cross-theoretical approach to mental health and child and adolescent wellbeing. So please welcome Fiona.
This is a great start. I can't even work to do the lucky. There it is. Hi everyone, welcome, and thank you for being really good sports and sitting at the tables. What we're going to do later is some symbol work. So I just wanted to talk about the Sandtray Therapy, and Margaret Lowenfeld developed Sandtray Therapy 100 years ago. This method is 100 years old. And she is a paediatrician, and she worked with children and teenagers with basically intergenerational trauma. I just want to make my slides a bit bigger. Don't know if I can. No, now I'm going backwards. That's the way. Thank you very much. Thank you. Yeah. So it's a pluralistic approach. So all of you understand that that means you can integrate the SAND into your theoretical framework, whatever your orientation is. It's an indoor activity, psychotherapeutic activity, where you use SAND symbols. You'll see on your table will be some symbols, and it can be also an outdoor activity as well. So it can be applied across the spectrum to treat and assess things like externalizing and aggressive behaviours, ADHD, complex trauma, emotional issues. It's being used currently in schools in the UK and America with special needs. And in group work with children that are kind of, you know, not wanting to go to school very successfully. It's cross-cultural. Kids that are neurodiverse, ASD, Downs, cerebral palsy, all spectrums of the disability engage really well with the Sandtray Therapy. LGBTQI, family, it's a family therapy. It's developmentally and attachment focused. And there is some really good research around using it for anxiety, depression, PTSD, intergenerational trauma. Can also be used for grief and loss. So there are a large number of empirical studies that are published. Most of them are non-English. So we do know and we do understand that hopefully with the help of AIFS we're going to get some research happening, which we're really, really excited about. Just a side note, in Switzerland this is on their version of Medicare as a line item. So that's kind of how different it is. We do have some recent research coming out of America. So we have a World Association of Sandtray Therapy Professionals, and their research that came out at the end of last year, so 2023, Sandtray Therapy appeared to have a large effect treating depression, anxiety, and self-concept. And the most change that was noticed was basically in that parent-child relationship. And I've heard that being talked a lot about at this conference. How do we get parents to engage with the children playfully, mindfully? So maybe this is it. And the largest impact, which makes sense, was on family systems. Now, it's interesting to note that there was no significant movement with anger. But if you know and follow the work of Dr. Ian McGilchrist, anger lateralizes to the left. So we're kind of right brain, right hemisphere, bottom up approach. It is a whole brain Sandtray Therapy is a whole brain approach because it engages and stimulates both hemispheres. So what are the objectives of groups and individuals? So I'm talking groups and individuals here. So what we're looking for is the hope, purpose and meaning. And we start with building worlds. And the reason the clients build the worlds is because they have these internalized stories, right? They're holding on to these stories, and what they want to do is they want to make that invisible, that unseen, that felt. They want to externalize that. And so Sandtray Therapy provides that symbolic language for them to do that. And we're all therapists here, so you understand it's contained, it's therapeutic. And so once they've built worlds, then comes the storytelling. So in the telling of the story, using that symbolic language, the client is able to change their trauma narrative. The client is able to, if you're cognitively focused, if you're solution therapy focused or CBT, this is where you can start to engage with your client and dig a bit deeper. So through that self-reflective activity. So the next stage is that integration where the therapist comes in to get down, look at that sand world with the client and have a look what's presented. And the therapist is non-directive, non-judgmental, all those beautiful micro skills that we have. We don't ask any questions apart from open and curious questions to our client. I'm talking about the SAM worlds now. So that gives the client that room, that space to explore. And that's the process of creating, and that gives the client new perspectives, new insights, and hopefully through that process they are changing brains, neuroplasticity. Okay, so symbol work. At the heart of Sandtray Therapy is symbol work. If I hold this up, what's the first thought that comes to your mind? Yell it out. It's your meaning, right? It's your meaning. So have a look at the difference. So if we put our therapist's hat on and let's think about our theories, right? It's pluralistic. So I'm going to come from this stance. We have an egg. Someone said fragile. Yeah, because I could drop it at any minute, all right? If that chick is going to hatch, it's just going to fall and basically fall onto the ground, and it's going to be open to the environment. Predators, threat. You see where I'm going? Does that feel different now? Yeah. So we could break it down. Insecure attachment, secure attachment. Let's give it another go. I hope you guys can see all this. So this is, so I talk about tiger mama. This is a tiger dragon, okay? So this dragon is sitting on her eggs. She is so vulnerable, isn't she? She is threatened. Look at that look on her face. Don't you come near me. Don't you attack my eggs. Leave my babies alone. She's raging. She's just had babies. She's vulnerable. She's hatching those eggs. All right? But does that feel differently? Does that feel different? So she's gone from having... So think about Maslow's hierarchy of needs, basic needs. She's got no home. She's gone from having no home, no shelter, to having that shelter, Maslow's basic needs. That's how we get to read the language of symbols. And I want you guys to have a go. Okay, so on your table, and if you're at home, I would love you to go into, or at the office, you should be at the office, right? I would like you to go into your office space and choose a symbol. If you don't know what a symbol is, it doesn't matter. Just choose something that is on the shelf at work or whatever. Those of you that are here, on your table, you have a box of symbols. What I'd like you to do is very quietly, because we're going to do mindfulness-based symbol work. So we do that mindfully. So I want you to choose... I want you to choose quietly 2 or 3 symbols. Now, mindfulness-based means that what you are doing is you're feeling that symbol. What does it feel like? Is it rough? Is it smooth? Has it brought up a memory for you? Past, present. Does that symbol speak to you like a song would remind you of a place, a time, a person? So you can put those symbols together, group them together as in relational. You can have a single one, but just take a moment right here, right now, just to be in the moment and have a little play. Put your symbols together. If you're not going to join, then that's fine. Just be in the moment here now and feel that quiet of the room. Now, your symbol may require a little support. If you're feeling or sensing, just like I showed you there, that your symbol is feeling a bit vulnerable, grab a mate for it and put it there to support, to scaffold. Hey, we can't go there yet. So what I don't want you to do is to engage with your neighbour. This is a really personal exercise. Just take a little moment just to be in the moment. So the symbols that you have on your table, if you have a look at this case study, here we have a 16-year-old teenager who had to confront the upcoming release of her rapist who was coming out of jail. So what we do in that case is we want to bring in the hope, that purpose and the meaning we don't want to minimise what she's been through and how she's coped, but we want to add some extra strengths to that. And so she wanted to confront her perpetrator. So I guess you can figure out who the perpetrator is. And so what we did with her is we did some solution focused and we did some CBT so that she could come to the place where she was able to set herself up so that she could make decisions about how she was going to respond, because we can't change what happened, right? We can only change her mindset and how she's going to move forward, really. And she did that through the Sandtray Therapy. So we looked at that research about the internal family systems. This is advanced level stuff. I don't expect any of my therapists that I train to do this level until they become advanced therapists. So I just put my Jungian hat on for a bit. So I was holding 4 psyches in this tray. So it was mum, dad, 2 children. So when we talk about kids needing to find their voice, not only do they need to find their voice, but they also, once they've found that voice, they need to be heard, right? So mum and dad were separating. The brother was angry and the daughter was not heard. She was not seen. And so she went real quiet. So in this family therapy, I could let every single person in that sand world have a voice, express to their parent, to their sibling, how they really felt, and everyone had to stop and listen. So you can see that within this, there are stories within stories. Okay, so this is 4 people in the sand. So we talk about food insecurity. So this case study was an out-of-home young girl, 5 years old, complex trauma. She was taken with her sister at a very early age. I think she was 2 and his sister was 12 months old. So this is a typical food security played out in the sand. And we're looking at unmet needs, right? So we can take that back theoretically to Maslow's hierarchy of needs, and what this young girl is, she's processing through the unmet needs. Peeling the onion layer, right? These kids with complex trauma, there's something else, something else, something else. So we start where the child is at. And according to the Australian Institute of Family Studies, food insecurity, it's a real concern for everyone really. And some of the impacts on schooling, education, their ability to learn, but also it impacts on health. So if we want to have a society of healthy children, surely we want to have early intervention. We're going to do some more research on this. We're really looking forward to doing some research on this. So anyone that wants to join us, but that's the early intervention, family therapy, and of course working with everyone. Sandtray Therapy loves everyone. You can be 3, you can be 103, you can speak English, you can speak, I don't know, Dutch. It doesn't matter. It's like me, it loves everyone. All right, thank you very much.